Welcome to Genus Healthcare Solution, and today we will discuss some more topics on ICD-10-CM, which includes adverse reaction, diabetes, fracture care, and sepsis. So our first topic will be adverse reaction and poisoning. So as we already know that there is a drug and chemical tables in our ICD-10-CM book, which consists of 7 columns. In the first column, there is a mention of chemicals. So in first column, we will able to check the name of the chemicals or the medicine. There are next 4 columns are dedicated to poisoning. So there are four conditions, which is poisoning unintentional, poisoning self-harm, poisoning assault, and the last one is poisoning undetermined. So in the first one itself, understanding accidental, if somebody taken any medicine or any chemicals by mistakes, so that's fall into the accidental category. If somebody have taken the overdose of the medicine for the self-harm, then we can take self-harm condition. And if somebody forcefully need to take medicines or chemicals, that will fall into the assault category. And if we are not able to identify whether it's assault or self-harm or accidental, then we can choose the category undetermined. Then we have adverse effect column, and then we have underdosing. So first we will going to discuss the adverse reaction. So we will consider adverse reaction in the scenario when if patient have any problem and he visited to the physician, and physician check the patient and prescribe medicines. So suppose he prescribe medicine A 1 tablet, okay, and patient also take medicine A 1 tablet, and after he consume the medicine A 1 tablet, he get some sort of reaction. He gets nausea, he get vomiting, or he get unconsciousness, dizziness, and now he return to the physician. So in this scenario, we will need to code the adverse reaction of that medicine as the principal diagnosis. So the adverse reaction can be like nausea, it can be vomiting, it can be dizziness, it can be unconsciousness. So it will be your principal diagnosis. The second code we need to use for adverse reaction of that medicine. So there will be 2 codes. Principal diagnosis will be the adverse reaction, and the secondary diagnosis will be the principal diagnosis will be the adverse reaction, and secondary diagnosis will be the adverse reaction of that particular medicine. So here adverse reaction, I am just saying the principal diagnosis. That means the reaction patient got. So if there is a nausea and vomiting, that reaction will be the principal diagnosis, and the adverse reaction code we will get from the drug table will be the secondary diagnosis. So if I take the example, if a patient take albuterol prescribed by the physician and he take correct dose, okay, and after taking the albuterol he get vomiting, and now he went to the physician. So in this particular scenario, vomiting will be the principal diagnosis, and code for the vomiting is R11.10, and the adverse reaction of the albuterol is the secondary diagnosis. So the code for albuterol, we need to go into the drug table, and under the drug table we need to check the albuterol medicine, and under the albuterol we need to check the adverse reaction, and we will identify the ICD-10-CM code. And when we check that, the code is 6-digit codes. So how we will get the 7-digit code? As I already told you that all the S and T codes are the 7-digit codes. So for that we need to go into the tabular index, and in the tabular index we will find the situation that the 7th character can be A, the initial encounter, D, the subsequent encounter, and S is the sequel. So in this scenario, because this is the first visit after the reaction patient got, so our 7 digit will be A in this particular case. So we need to provide two code R11.10 for vomiting and T42.0x5A for adverse reaction. So this is the only condition in which adverse reaction happen. So the patient take the correct dose and he get the reaction. Now we move to the next section of this poisoning. So there are multiple scenario of the poisoning. So the first scenario is patient take correct dose with alcohol. So if patient have any problem and physician prescribe a medicine and patient take correct dose of the medicine but he also consume the alcohol, and after that he get some sort of reaction. Again, it can be a vomiting, it can be a nausea, it can be dizziness, giddiness, any sort of reaction he get. And now he visited to the physician. So this will consider as poisoning. So in this scenario, poisoning will be the principal diagnosis and reaction will be the secondary diagnosis. So whenever patient get poisoning of any medicine, poisoning will always consider as the principal diagnosis. So if we take the same example for albuterol, then what happened that poisoning of albuterol will be the principal diagnosis and the reaction vomiting will be the secondary diagnosis. Then we have second example. So second example, we have second scenario as we can say in the poisoning. So if patient take overdose, okay, so if physician prescribe medicine A 1 tablet, but he take more than 1 tablet, it can be 2 tablet, 4 tablet, and it's also dependent why he take more than 1 tablet, because in that scenario only we are able to get the poisoning is accidental, or the poisoning is assault, or poisoning is for the self-harm, because the reason is very important why he take more than 1 tablet or why he take more than prescribed dose of the medicine. So again in this scenario the poisoning will be the principal diagnosis, and the reason for the poisoning, like the whether it's assault or it's self-harm or it's accidental, or if we are not able to judge anything, then we need to take the undetermined poisoning, and the reaction will be the secondary diagnosis. Then the third scenario, where physician prescribe any medicine and patient take prescribed medicine, correct dose, as well as he also take unprescribed medicine. So if he mix both prescribed medicine as well as the unprescribed medicine, in this particular scenario, if he get any reaction, poisoning will be the principal diagnosis and reaction will be the secondary diagnosis. So all the three scenario where patient take the correct dose plus but he also consume the alcohol, or the patient overdose the medicine, or he take prescribed medicine with unprescribed medicine, poisoning will be the principal diagnosis and secondary diagnosis will be the reaction. So whatever reaction will be there, it will be the secondary diagnosis. But in case of the adverse reaction, reaction will be the principal diagnosis and adverse reaction will be the secondary diagnosis. Next condition is toxic effect. So again, toxic effect by default fall in the poisoning scenario, because physician never prescribe any like toxic substance which can be a germicide, pesticide, homicide. So whatever toxic content consumed by the patient, it always fall into the poisoning category. So the principal diagnosis in this particular scenario will be the poisoning, and the secondary diagnosis will be the reaction. So again, normally it's either it will be accidental, or it can be a self-harm, or it can be assault, or if we are not able to determine whether poisoning, this condition happen by the self-harm consumption of the toxic effects, or somebody give the that to the patient. The last condition in this category is underdosing. So if patient have any problem and physician prescribe medicine for like 1 week, 2 week or 1 month, but physician did not take on regular basis. He stopped the medicine after a couple of days. In that case, if his condition gets severe and he went to the physician, so this scenario will be considered as underdosing. So in this particular scenario, the worsening of the disease will be the principal diagnosis and underdosing will be the secondary diagnosis. And we also need to put an additional code for non-compliance of the drug regimen. And sometime due to financial hardship, he also not able to take the complete dose of the medicine. So that again fall in the non-compliance due to financial hardship. So these are the scenarios which we discuss for adverse reaction, poisoning, toxic effect and underdosing. So all the code of these adverse reaction, poisoning, toxic effect and underdosing we will find into the drug and chemical table. But the reaction code we need to search as usually from the alphabetic index. Our next topic is diabetes. So there are two categories of diabetes mellitus type 1 and diabetes mellitus type 2 or unspecified type. So in diabetes mellitus type 1, patient cannot survive without insulin. So if he has type 1 diabetes mellitus, so he need to be regularly take insulin. So we can say that type 1 is insulin dependent diabetes. But in type 2 diabetes, patient can or cannot take insulin. So it's depend on that how much blood sugar he have. It's on the higher side, then physician give the insulin. Otherwise, his diabetes can be managed on diet or oral medication. So there are, so type 1 category we normally use E10 series code and type 2 category we use E11 series codes. There are some other types of diabetes also. E08 codes category we use for secondary diabetes mellitus. E09 category codes we use for drug or chemical diabetes and E13 for any other specified diabetes. So secondary diabetes mellitus we will consider if patient underwent any surgery and after that he get the diabetes. Or drug or chemicals diabetes will be patient using some chemicals or drugs and after using these medicines he get the diabetes. So that will be the drug induced diabetes. If patient is have diabetes and he is taking insulin, so we need to provide an additional code Z79.4 to represent this, that patient is on long term or current use of insulin. But remember that as type 1 patient is always take insulin, so there is no need to provide an additional code Z79.4 if patient is type 1 diabetes mellitus. So we never use Z79.4 code with E10 series code. So there may be a certain scenario which we can discuss. So in the first scenario, patient diagnosed with type 1 diabetes and he is on insulin therapy. So in this scenario, we only use one ICD code and that is E10.9. So there is no need to use additional code for insulin Z79.4. In the second example, if we say that patient diagnosed with diabetes mellitus, so he did not mention that whether diabetes mellitus is type 1 or type 2. So by default, we always take type 2. So the type 2 diabetes mellitus code will be the E11.9. Third scenario, patient is diabetes and he is on long-term use of steroids. So patient developed diabetes on long-term of use of steroids. So again, steroids are medicine or we can say drugs. So the diabetes code will be the E09.9 in this particular scenario. The fourth example, if patient is diabetes and he is on long-term use of insulin. So this is again type 2 diabetes mellitus and the code will be the E11.9 and as the patient is on long-term use of insulin, So we need to provide an additional code Z79.4 in this particular scenario. The next scenario is if patient have diabetes and he has complication due to diabetes. So we need to always provide all the complication of diabetes. It can be a diabetic retinopathy, it can be nephropathy, it can be neuropathy, angiopathy, peripheral vascular disease, foot ulcer, gangrene or chronic kidney disease. So apart from the retinopathy, all other complication by default we can correlate with the diabetes. But in case of retinopathy, physician clearly mentioned that retinopathy is due to diabetes or secondary to diabetes. But in case of neuropathy, nephropathy or chronic kidney disease, foot ulcer, if physician mention diabetes and these conditions, by default we can consider these. So most of the time we will get the single code for these conditions, but if additional code required, then we need to provide an additional code also. But diabetes code in these scenarios will be the principal diagnosis. So if we say that a patient have neuropathy, so all scenario we are going to discuss for type 2 diabetes. So if patient have neuropathy, then we have E11.40 code. If nephropathy, E11.21. If diabetic retinopathy, E11.319. Angiopathy, E11.51. And vascular disease, E11.51. Diabetic foot ulcer, E11.621. Diabetic gangrene, E11.52. And diabetic with chronic kidney disease, E11.22. So nephropathy, it's a 21, and CKD, it's a 22. And if physician is long-term use of insulin, then we can provide Z79.4 an additional code in the manifestation also. So if I take one example, a 35-year-old patient with type 2 diabetes and long-term use of insulin. So this is a simple scenario where we need to put a diabetes code E11.4 and long-term use of insulin Z79.4. Then we have example 3, diabetes with retinopathy and nephropathy. So here there are two manifestations of diabetes. One is nephropathy and one is retinopathy. So we need to provide two code for diabetes. One is E11.319, which is diabetic retinopathy, and another is E11.21, which is diabetic nephropathy. And as the patient is on insulin, so we need to use an additional code for long-term use of insulin or current use of insulin, Z79.4. The next scenario is insulin pump malfunction. So if a physician insert insulin pump for releasing of insulin, then there can be a malfunction also. So there can be a two scenario of insulin pump malfunction. One can be it overdosing and one can be underdosing. So if insulin pump get malfunction, it can release more insulin or it can be release less insulin. So in case of more insulin, it will be the poisoning, and less insulin will be the underdosing. So if I take the example of overdosing, so we need to provide three code in this particular scenario. First code will be the insulin pump malfunction, which we can get complication of insulin malfunction. So we will go in the ICD-10-CM book, alphabetic index, and we need to go in the complication, and under the complication we will find insulin pump. And there are certain reasons mentioned that what is the reason of insulin pump malfunction. So we need to take appropriate ICD code according to the situation mentioned in the medical record. Then the second code, we need to take the accidental poisoning of insulin. So we need to go into the drug and chemicals index table, and from where we need to search the insulin, and under the insulin we need to take the accidental poisoning one. And then we have need to provide an additional code for the diabetes, because insulin is giving for diabetes type. Then the second example is underdosing of insulin. So in the underdosing of insulin, again the first code will be the malfunctioning of the insulin pump. Second will be the overdosing of the insulin, which we again get the ICD code from ICD-10-CM index, and there is a table mentioned, drug and chemical table. So in that drug and chemical table, we need to check the insulin and take the underdosing code, and the last code will be the insulin. The last code will be the diabetes code. So whether it's a type 1 diabetes or type 2 diabetes or it's a secondary diabetes, so whichever diabetes type mentioned in medical record, so we need to provide diabetes codes according to that. So key point we need to remember that if patient have type 2 diabetes, we can use additional code for insulin Z79.4, but if the patient is type 1 diabetes, we cannot use Z79.4. If there are multiple manifestations of diabetes, we need to provide ICD code for all these manifestations. So this is the brief introduction about the diabetes. And one more thing we need to remember, that if physician is giving the oral insulin, oral medication, and he is also giving the insulin, injectable insulin, so we need to provide code for both the conditions. So Z79.4 code we have for insulin, and Z79.84 we have for oral hypoglycemic. So if suppose patient is type 2 diabetes and he is taking injectable insulin and he is also taking the oral hypoglycemic, so we need to provide code for both the conditions. So insulin code will be the Z79.4 and oral hypoglycemic code is Z79.84. Our next topic is sepsis. So sepsis is a life-threatening condition that occurs when infection triggers a systematic inflammatory response throughout the body. It can originate from infections in the lung, urinary tract, skin or gastrointestinal tract. So there are certain guidelines for sepsis coding. So we will go one by one. So to assign a code for sepsis, we need to provide a microorganism, because sepsis only happen if there is a microorganism present in the blood. So first we need to provide the microorganism code, and to search the microorganism code, we need to go into the sepsis in the alphabetic index and need to search microorganism over there. So there are some common microorganisms are MRSA, the code will be the A41.02, then we have E. coli sepsis A41.51, and then we have Enterococcus sepsis A41.81. So these are the some common sepsis code. In case of severe sepsis, so if patient have sepsis and he get organ failure due to sepsis, so the sepsis will become the severe sepsis. So in case of severe sepsis, we need to provide two code. One code for sepsis, which we already discussed that you need to go into the alphabetic index entry sepsis, and you need to provide code for the microorganism. And the another code we need to provide for severe sepsis. So there are two codes available for severe sepsis. One is R65.20, severe sepsis without septic shock, and another is R65.21, severe sepsis with septic shock. So if there is a mention of septic shock, we need to provide R65.21. If septic shock is not there, then we need to use R65.20. And we need to provide an additional code for the organ failure, because severe sepsis will only happen if there is a organ failure mentioned in medical record. So type of heart failure we also need to provide. So severe sepsis can only happen if there is acute organ failure. If there is chronic liver failure, so most probably that is not due to the sepsis. So in case of severe sepsis, we need to provide three code, one for sepsis, another code for severe sepsis, and another code for the organ failure. So if I take example of acute liver failure due to MRSA sepsis, so my first code will be A41.02, second code will be the R65.20 because septic shock is not mentioned, and my third code will be the K72.00 acute liver failure. And if it become like is mentioned that acute liver failure due to MRSA septic shock, then the only thing need to be changed, the code R65.20 will be converted into R65.21. If patient is pregnant and she also have sepsis, in that particular scenario, we never use A series code for sepsis. O85 code we need to provide puerperal sepsis, and for microorganism we always take B series codes. So in case of the pregnancy, we cannot use A series code A41.02, 01 or any other code in pregnancy. There are some special cases of for the sepsis, like sepsis due to post-procedural infection. So in the sepsis of the post-procedural infection, we need to provide code for post-procedural infection, and we also need to provide microorganism code. So here there is an example like post-procedural MRSA sepsis. So first we need to provide post-procedural complex post-infection following post-procedure, which is like T81.43X, just an example. And for MRSA sepsis, we need to provide A41.02. If patient has sepsis with localized infections such as pneumonia or tuberculosis, then we need to provide first code for sepsis and second code for the localized infection. Urosepsis is not considered as sepsis. So if physician mention urosepsis in medical record, so it will be just urinary tract infection. It is not a kind of sepsis, because sepsis can be only happen in blood. It cannot be happen in urine. Next is bacteremia versus sepsis. So bacteremia and sepsis are both there. So next is bacteremia versus sepsis. So bacteremia and sepsis are two separate things. So if bacteremia is mentioned, we need to provide R78.81 code, and if sepsis is mentioned, we need to provide A41.9 if microorganism is not mentioned. If physician did not mention sepsis, but he mentioned microorganism. So till now we learned that MRSA sepsis, MSA sepsis, Enterococcus sepsis. So if what happen if only MRSA is mentioned or Enterococcus is mentioned? So in this scenario, we cannot take code from the A series. We need to take code from the B series, especially B95 and B96 series. So I just give you the example, UTI due to E. coli. So if there is a combination code available for UTI due to E. coli, we need to provide combination code. If combination code is not available, we need to provide disease code first and microorganism code second. So in UTI due to E. coli, we do not have combination code. So in this particular scenario, UTI code N39.0 will be the principal diagnosis, and E. coli code B96.20 will be the secondary diagnosis. But if there is a combination code available, then we need to use combination code. So the next example is Klebsiella pneumoniae. So there is a combination code available for Klebsiella pneumoniae J15.0. So there is no need to provide any additional code. Sometimes physicians mention microorganism in medical record, but we are not able to find code for that particular microorganism. So what in this scenario we can do? So there are always two codes available, one for gram negative and one for gram positive. So we need to check whether the microorganism which mentioned by the physician is gram negative or gram positive, and according to that we can take the gram negative or gram positive code. But that will be our last option, because first we always need to find the specific microorganism code, and if we are not able to find the specific microorganism code, then only we can use these codes. Then we have MRSA and MSSA colonization. So if patient MRSA and MSSA bacteria is in patient body, but it is in inactive mode, then we can use MRSA colonization or MSSA colonization ICD codes. But if patient have MRSA or MSSA colonization and also have the active bacteria or virus, then we can use both the codes. So there are some coding tips to code sepsis. So as we discussed, always use sepsis code as a principal diagnosis. It's a MRSA or MSSA, Enterococcus, E. coli, any microorganism sepsis. So we need use as a principal diagnosis. If patient have severe sepsis, then we need to provide code for sepsis, then severe sepsis, then organ failure. And if the patient have septic shock, then again we need to use sepsis code, severe sepsis with septic shock, and organ failure code. If patient have sepsis and pneumonia, we need to provide code for sepsis as well as pneumonia. But if patient have pneumonia and sepsis, he gets sepsis after admission. In that case, pneumonia will be the principal diagnosis and sepsis will be the secondary diagnosis. So these coding guidelines are for sepsis, and we need to use very carefully, because sepsis is a inpatient diagnosis. Very rare you will find that patient came into the physician office and you need to provide code for sepsis, because if patient have sepsis, because bacteria and virus in his blood, so it can lead to a organ failure. So it's require immediate admission of the patient, and once he get treatment, then only he can discharge from the hospital. So sepsis is always a hospital inpatient diagnosis rather than hospital outpatient diagnosis. Our next guideline is for fracture. So there are two types of fracture, displaced fracture and non-displaced fracture. So unless physician mention that it's a non-displaced fracture, by default we will take a displaced fracture. And there are two categories of fracture again, open fracture and closed fracture. So unless physician mention open fracture, by default we always take closed fracture. So what is the difference between closed fracture and open fracture? In closed fracture, the bone should be inside the skin, and in open fracture, bone will be visible through the skin. So there are some terms either need to mention by the physician, like missile fracture, burst fracture, impacted fracture. Then we can consider the open fracture. Otherwise, we always need to take closed fracture. So it is very important because sometimes coders get confused, because if physician mentioned that the procedure is open reduction internal fixation, but he did not mention whether the fracture diagnosis is closed or open. So by seeing the open term in the procedure, most of the time coders take the open fracture code. But unless physician mention open fracture or use any word which indicate open fracture, we cannot take open fracture code. So by default, always we take closed fracture code. As fracture code start with the A, so it's a very important that all fracture code will be the 7-digit, and the 7-digit will be the fixed series by series. So I will be going to discuss some common 7-digit character. If fracture is closed, then the 7-digit will be A. If fracture is open, the 7-digit will be B. If there is a routine healing, 7-digit will be D. If there is a delayed healing, 7-digit will be G. If there is a non-union, we can use a K as the 7-digit, and if there is a malunion, we can use P. And for sequelae, there is a S. So these are the 7 characters, but these characters can be changed. So every series you always need to cross check that what will be the 7th character for that particular series, and according to that we need to provide 7th character information in our code selection. There are two categories of fracture. One is traumatic fracture and one is pathologic fracture. So unless physician clearly mention the pathologic fracture, we always need to provide code for traumatic fracture, and traumatic fracture code start with the S. And if he mentioned that patient has pathologic fracture or the compression fracture, in this scenario we need to use fracture code from the M series. So right now I am going to discuss some example with you. The first example, right distal radius fracture. So how we need to search for this code? We need to go into the fracture. Under the fracture, either we need to search the radius or radial. So both are the same, radius or radial. Then we need to check the distal. So sometime you found the distal, and if you did not found the distal, then it's indicate that you need to take the lower end. Okay, and we will found the code over there. And we also need to provide code for left and right, because if fracture is in the extremity, then we have code for the left side as well as the right side. And this particular scenario, the open or close is not mentioned. So by default, we will take close fracture code. So S52.501A is the initial encounter for a close fracture of distal radius. Then we have right mid-shaft fracture. Again, it's not mentioned open or close. So by default, we will take close fracture. In the next example, it's a right mid-shaft fracture, open fracture. Then we need to take open fracture 7 digit, which is B. Then malunion of right mid-shaft fracture, the code again will remain same, because femoral mid-shaft fracture code is same. The only thing we need to change the 7th character or the last digit. And then we have left tibial bone fracture. Again, it's not mentioned whether it's a open fracture or closed fracture. So what we are going to take closed fracture. Then we have left ulnar fracture. Again, it will be a closed fracture. And second left rib fracture. Again, it's not mentioned whether it's a closed or open. By default, we will take closed fracture. So it's a very clear and simple guidelines for fracture. Until unless physician clearly mention the open fracture, by default we take closed fracture. So today we have discussed the guideline for adverse reaction, poisoning, underdosing. Then we discuss diabetes. After that we discuss the sepsis guideline, and last we discuss the fracture guideline. So these guidelines very important, and you need to carefully provide ICD code following these guidelines in your medical record. If you need any information regarding CPC certification or any special training, you need to drop WhatsApp message on 9911 593677, or you are looking for any specific video or surgery training or ED training, IPDRG training, you again note either drop message on 9911 593677, or you can write an email at info@genushealthcaresolution.com. Our team will get in touch with you and provide all the required solution for you.